Thank you all for coming. Every one of us probably can name someone who has been diagnosed with breast cancer. For me, that person's my mom. The most common type of cancer among women in the U.S. and the second leading cause of cancer deaths in the U.S. among women is breast cancer. Today, my purpose is to inform you all about breast cancer and how to take a few steps to prevent yourself. All cancer begins with cells when they begin to grow out of control rapidly and invade other tissues. According to the American Cancer Society, roughly 288,000 women will be diagnosed with breast cancer in 2011, and roughly 40,000 will actually die from breast cancer. Today I will be discussing breast cancer awareness. First, I'll discuss the early detection screening process, and then I'll discuss some signs and symptoms of breast cancer along with some treatment options. The early detection screening for breast cancer is probably one of the most important steps you can take to prevent yourself. Screening is actually done by performing tests and exams on patients who don't have any signs or symptoms of the disease. Mammograms are actually the most common form of breast cancer. They are low doses of x-rays that can detect tumors up to 2 years before they are actually felt. And those who actually undergo the mammogram screening process decrease their chances of dying from breast cancer by 30%. Other types of breast cancer screenings are a clinical breast exam, which are done in a hospital setting done by the physician during physicals, and also a self-exam, which can be performed yearly by the individual. Early detection of breast cancer is important to help increase the chances of treatments working and to show signs and symptoms of breast cancer. Most signs and symptoms of breast cancer are actually not detected or seen. They don't show up until later along in the stages of breast cancer. The most common sign of breast cancer is a lump. It's usually cancerous when the edges are uneven, and then it's hard and painless. Other common signs are change in size or shape of the breast, the breast ridges, the ridges or pitting of the breast, or a change in the look or feel of the skin of the breast, such as warmth, scaliness, or redness, or swelling. And sometimes breast cancer can even spread to the underarm of the underarm lymph nodes before causing swelling or a lump to occur before and any tumor is felt. Knowing the importance of early detection along with the signs and symptoms of breast cancer and understanding the treatment options for those who are actually diagnosed with breast cancer is another important step. Breast cancer has many treatment options, but four of the most common are surgery, chemotherapy, radiation, and hormone therapy. Surgery is the most common form, which actually removes the cancer cells, and then it can be done by a lumpectomy or a breast reconstruction. A lumpectomy actually removes all the cancer cells as well as some healthy tissue around it, just to make sure everything was removed. And then the breast reconstruction is actually when the whole breast is removed, and then they rebuild it basically. Radiation therapy uses the high energy of x-rays to help kill the cancer cells, and it usually goes hand in hand with surgery. And it helps the cancers to kill the cancer cells and to keep it from growing. Chemotherapy is the use of drugs administered orally or through injections to kill cancer cells. Hormone therapy removes hormones to block their actions and stop the cancer cells from growing, and it actually can impact some of the breast cancers, but only if those hormones are actually being produced. In conclusion, early detection screening can help us reduce our chances of breast cancer regardless of the signs or symptoms, as well as increasing our chances of treatments actually working and being effective. Thank you all for your time. I hope you learned something about breast cancer awareness and have become more aware of this disease that not only affects just women, but it also affects men, which I think is fairly important since people rarely know that. Thank you.